my name's Stephanie, as she said, and began practicing in the Valley so long ago. I'll date myself here. I graduated from PA school in '01 and very traditionally trained, practiced all the standard protocols. If you could name a pharmaceutical, I'm sure I probably prescribed it. And that was how I continued practicing for years and years and years. And it was probably around 2018, maybe 2019, that it just became clear that I'm doing all the things I'm supposed to do. I'm checking all the boxes. I'm treating patients the way I'm supposed to, and I'm not making any difference. Patients are still getting sick, and they're still diabetic, and they still have heart disease, and they still have hypertension, and they still have cognitive decline. Something is wrong with this system. And so that was when I kind of began to diverge from that traditional path. But it's super hard. You've spent all that time and all that emotional energy learning, and it's difficult to find solid, reputable training in a functional or foundational mindset. And so that process has been very slow for me, and I still have so much to learn. But I'm making that transition over, and so I told Amanda I kind of feel schizophrenic. Like I have this allopathic side, and now I've got this functional side, and I'm trying to figure out where the two fit. But so today we're here to talk about hormones. And how many of you have an understanding or have done your own research or a little bit? Okay, so hormones, especially for females, are, and as we become a little more gray-haired, become more and more pertinent to us. We begin having things occur with our bodies that no one prepared me for. Weight gain that I can't lose even though I exercise and eat right, and these hot flashes and these night sweats, and my moods are all over the place, and this belly that wasn't here before. Things start happening, but what do we do about it? We try to eat right. They tell us calories in, calories out, and we don't sleep well anymore. And we've probably seen our mothers or our grandmothers transition through this, and some have had terrible experiences, and that's challenging to watch when you see someone who becomes almost another person. Even we can look in the mirror and think, I don't recognize this person anymore. Who am I? And I kind of feel crazy. So a lot of that, and I won't say every single thing can be chalked up to hormones, but that is a huge underlying piece of this puzzle for us as women. Men have their a similar decrease in hormones, but oftentimes those symptoms can be a little more subtle. And for us, it's so dramatic. Our whole adult life is geared around hormone production. That cycle, how much does that impact our whole life? So then as those hormones begin to change, it's challenging to know what to do with that. The information can be very confusing, can be misleading. We'll talk more about it, but the Women's Health Initiative, which was published in 2002, that really put a lot of fear in people's minds of, are hormones even safe to use? Should we be doing this? Because they really got polled, and there was about an 87% drop in hormone use after that study was published. So, and then when it was kind of recanted in 2017, well, that didn't get near the publicity. And so there is data, and so part of what I want to do today is talk about hormones, talk about a rationale for using them, why they can be valuable, talk about how to use them safely, and the statistics. Are they safe? Is there a risk? And if there is a risk, how do we mitigate that and help us all feel better? So some of you, I'm sure you've probably seen those hormone charts of what do you experience in menopause? How many have had hot flashes, night sweats, breast tenderness, irregular cycles, sleep disturbance, anxiety, depression, anger, low libido, vaginal dryness, increased urinary tract infections, cognitive fog. All of that can really trace back to hormones. But even things that we don't think about, joint pain, frozen shoulder, way more common in women over age 40. Why? Hormones. So, it affects nearly every organ system in our body has estrogen, progesterone, and testosterone receptors. And so as those three primary hormones and DHEA, but as those hormones begin to decline, you can have symptoms literally anywhere throughout your body that could have a contributing factor from your hormone levels. And so we talk about hormone replacement, but we also talk about bioidentical hormone replacement. And what's bioidentical? Bioidentical are compounds that are synthesized from plants that exactly replicate what our body naturally synthesizes. And that's different than what traditional hormone replacement was. Hormones, they really began experimenting with hormones in the late 1890s. In 1940 is when estrogen kind of came on the market, and that estrogen was purified from the urine of pregnant mares. And you think about an estrogen that a mare would need has so many metabolites. When you have a compound, our body breaks that down into other components. And estrogen that a mare uses breaks down into 18 metabolites that are foreign to our body. And so to think of trying to replace our estrogen with horse estrogen doesn't really work that well. But that's what,
It doesn't sound.
yeah, but that's what was on the market. That's what was used for 40 years.
Wow.
And actually is still available for use.
My high school best friend actually, they had a horse farm that they harvested
produce.
the mare urine.
Yep.
Yep.
Let's harvest the
That was
urine.
their
That was her
crop.
Awesome. So
It's collected.
So that was the estrogen that was first provided for women, and then a synthetic form of progesterone called progestin. So norethindrone, medroxyprogesterone, those are synthetic. And the problem with those is they are not chemically identical to our progesterone. So when you have a chemical in our body that is similar but not identical, it will react differently with cell receptors. And it can block the intended effect, it can amplify an effect. Those potential effects are hard to quantify. So when you use a progestin instead of progesterone, that's where that increased breast cancer risk that was publicized in the Women's Health Initiative, that's where that came from. And we'll talk a little more about that in a minute. But progestin is a very different chemical than progesterone. And so those are the two reasons primarily that we talk about using bioidentical. We want a chemical that's inherently the same that our body produces, so it's going to react predictably with our cell receptors and do what those hormones are intended to do. So
And those come from plants, you say?
Yes. Yep.
Okay.
yeah,
Interesting.
and they're purified, but the chemical structure is the same as the natural hormone that we produce from
Okay.
the ovaries, the adrenal glands. So what are some of the benefits of using bioidenticals? And actually, I'm going to back up for just a minute. Delivery method of hormones. So there's three primary delivery methods. You can do oral hormones, you can do hormones applied to the skin, which we call transdermal hormones, you can do injectable hormones, and you can do pellets that are implanted. that are a longer duration. Oral hormones, you cannot take testosterone orally, and taking estrogen orally is not an ideal way to deliver estrogen, even though it has been used for, what are we on now, 80 years. And the reason is when we take a medication orally, goes into the gut, gets absorbed into the bloodstream, and immediately gets delivered to the liver. And that's what we call first pass. So when that estrogen goes to the liver immediately metabolizes off 90% of that dose. So if you were to take, and this is not a realistic dose, but just for example's sake, if you took 100 milligrams, only 10% of that is actually going to get sent out to your body. 90% gets broken down immediately. But each of those breakdown products has an effect in our body. For example, our breast has estrogen alpha receptors and estrogen beta receptors. Well, some of those metabolites from that estrogen stimulate alpha, which is pro-cancerous. Some stimulate beta, which is protective from breast cancer. So if you're taking a huge dose of estrogen in order to get that 10% to help your bones and your brain and your vagina and your mood, that 90% may be having an adverse effect on your breast. And so that's also a contributor to that idea that estrogen causes breast cancer, which has been negated, but if you're using oral estrogen, you are potentially increasing that risk. So an oral estrogen is not ideal. Applying estrogen through the skin, applying it through a mucous membrane, because you can actually use estrogen vaginally through the labia, or having it implanted as a pellet. Those bypass that first pass phenomenon, so you can reduce that dose dramatically. The other problem with estrogen orally is it stimulates the liver to produce clotting factors. So you've probably heard that estrogen causes blood clots. Well, if you're taking that huge dose orally, you are going to increase that risk for developing a blood clot. So for the most part, unless there is absolutely no way someone can take any other form, we really say don't take it orally, because you eliminate almost reducing it to zero, that risk for breast cancer, that risk for blood clots, by bypassing that first pass. If you take oral, then that's a daily dose. If you take transdermal or applying it to the skin, that's a daily dose. Implanted pellets, those are about 3 to 4 months depending on your symptoms, and so those last much longer. We'll talk a little more about pellets in a little while, but progesterone can be taken orally because it does not stimulate that clotting, does not stimulate those alpha receptors in the breast, and it's a very large molecule. So applying progesterone to the skin, we do in some patients, and they do well. We monitor that with watching their blood levels, but some women don't absorb well. As we age, our skin changes. One more of those great effects. And so that absorption can also change, and trying to absorb this huge molecule through skin that is not nearly as young and vibrant and healthy as it once was can be challenging. So oftentimes we'll use an oral dose of the bioidentical progesterone. And then testosterone is never taken orally. Testosterone is always either a pellet or an injection. And it can be used as a topical as well. With testosterone, you do have to be a little cautious because that's on your skin, so depending on where you apply that, if you then are hugging on your female grandbabies, or if you are intimate, you can transfer that to other people. And so if you're using topical hormones, you have to be aware of making sure those are either covered or well absorbed before you have contact with other people. Questions at all with any of that?
Was good.
All right. So then, one of the other concerns with hormones is, when do I start these? Do I start them, as a 20-year-old? Do I start them as an 80-year-old? When is the ideal time? And with estrogen, progesterone, and testosterone, all of those hormones peak in our late 20s and then begin to decline. Progesterone is usually actually the first hormone to fall off. Usually by age 35, women are declining rapidly in progesterone. And that's often, approaching 40, that's when a lot of women will start saying, I just don't sleep very well. Well, progesterone's our calming hormone. And if we're dropping that hormone off, then in effect, we now have estrogen dominance, because that progesterone proportionately is not as high as it was, and you'll begin to experience a little bit of that effect. But by 40, our testosterone is about half of what it was at 20. So most women say, man, I just have no energy, I'm fatigued, I have no libido. Testosterone may very well be your culprit, even if you're still having regular menstrual cycles. So really, getting a baseline on hormones in your early 30s is not a bad idea. And then being aware of what those symptoms are. If you're starting to experience symptoms, it's not a bad idea to recheck. Maybe starting a low-dose progesterone, maybe starting a low-dose testosterone can be beneficial early in that period. Perimenopause, kind of that time around when our cycles begin to change, maybe they lengthen, maybe they shorten, maybe they're heavier, maybe they're lighter. That perimenopausal time is a great time, if you have not already had any evaluation, to look at those hormone levels and see where you're at. Supplementing a small dose of hormone during that period of time can make that transition so much less traumatic, emotionally and physically, and preserve your relationship with those that are near and dear to you. When we all kind of feel like we're losing our minds. And then certainly you want to start hormones sooner rather than later in menopause. There is not a hard cutoff, like, oh, you've been menopausal for 15 years, you cannot start hormones. But for one thing, we would start at a very, very low dose. You've been without for a long time. We're not going to hit you with a large dose, but your potential for benefit from a cognitive standpoint, that brain fog, from a heart standpoint, from your bone density standpoint, vaginal health, you're not going to get near the robust response that you could get. So really, it's that perimenopausal time where you want to be evaluating those hormones and potentially starting on some supplemental hormones, and certainly when you become menopausal. So menopause is a date. Menopause is 1 year from your last menstrual period. That's your menopause birthday. And then after that, you're considered postmenopausal. So,
I never knew that. That's so good.
Yeah, it's your menopause birthday. 1 year later, 12 months. So, and then, but you want to be on hormones because, as we talked about, hormones affect every body system. And if you look at women and men in their 40s, we hear about men dropping of massive heart attacks. You don't really hear about women so much. Occasionally, with this COVID craziness, there's more of that, but that's a totally separate topic. But you really don't hear of women dropping of a massive heart attack. Now go to 60s, and it's almost equal. Men will have a massive heart attack, women will have a massive heart attack. Why? We've lost that protective effect of estrogen on our blood vessels. Estrogen stimulates production of nitric oxide. Nitric oxide dilates blood vessels, so it has an effect on decreasing blood pressure. It protects against what we call endothelial dysfunction, meaning the lining of the blood vessels. It protects against those becoming more prone to developing plaque. So it has a significant effect on our cardiac health. And starting that estrogen early, we maintain that cardiac health through our menopausal years. Cognitive decline, that's a huge concern. We're seeing more and more Alzheimer's, Parkinson's, dementia, ALS, a lot of those cognitive diagnoses that are devastating to not only experience but to watch in a loved one. And protecting your brain. Our brain has estrogen receptors, it has testosterone receptors. So when we are feeling anxious, when we're feeling depressed, when we're feeling like we just can't stay on track, we're forgetting simple things, our brain is starved for that little bit of estrogen, and it can really clear. Estrogen is also, as well as progesterone, a stimulant for neurotransmitters. So dopamine, serotonin, norepinephrine, those are all neurotransmitters that are dependent in part, it's not the only thing, but dependent in part on hormones. So those can really have an effect there. Our bones are also super important. 1 in 3 women who have a hip fracture after age 70 will pass away within 12 months of that hip fracture. So bone density is huge. Osteoporotic fractures just rise at an almost exponential level after we go through menopause. And so having those hormones on board to protect our bone density is so critically important. Testosterone also has value in protecting our bones. And as we age, we don't want to just add birthdays. We want to be functional, we want to be healthy, we want to be doing the things we want to do. We don't want to be in the hospital with a hip fracture, and then all of the subsequent decline that comes from that. Vaginal health. Vaginal dryness is a real issue, and vaginal dryness leads to increased incidence of urinary tract infections, potentially bacterial vaginosis, discomfort, uncomfortable intercourse. All of that's related to estrogen production, because estrogen is what causes that mucus layer within the vaginal canal. And so maintaining that is so important, again, for just quality of life. And if you have recurrent infections, that again has that whole downstream effect, increased incidence of antibiotic use, potential for kidney infections, potential for sepsis. There actually are many women who have a urinary tract infection that then spreads into the bloodstream and they become septic from that. So again, a critical element of protecting our overall health. And so hearts, bones, brains, and then our muscles. We probably watched our moms and grandmas become tinier and tinier and tinier as they age, because they begin to lose that muscle mass. And testosterone in particular is so important. But when we think of muscles, we're not just thinking of, our arms and legs. What about that pelvic floor? So the pelvic floor is really dependent on testosterone. And leaky bladder, coughing and needing to be wearing a panty liner, not being able to get to the restroom on time, all of that is dependent on the musculature in our pelvic floor. And so actually using a testosterone topically in the either perianal or perineum area can be very beneficial in maintaining muscle strength of the pelvic floor, or beginning to strengthen it if it's already compromised, which if you've had vaginal deliveries, that pelvic floor is compromised. So most of us can all attest to that, and so a little testosterone can be super beneficial with that. So then just going into those are kind of some of the benefits, but what are those risks? And that's a very valid concern. And so the biggest risk that we hear about is breast cancer. And that came out of that Women's Health Initiative study published in 2002. What we now know is that it was only one arm of the study. The arm of the study that showed an increased risk of breast cancer was the estrogen with the progestin. So progestin was that synthetic form of progesterone that we now know is connected with an increased risk of breast cancer. So that when they reevaluated all the data and took that arm out and looked at just the women who were on estrogen, there was no longer that increased risk of breast cancer. So it really is that progestin component that was what caused that increased risk of breast cancer. When you look at breast cancer, it's not just estrogen. Breast cancer is genetics. Breast cancer is toxin exposures over our lifetime. Breast cancer is radiation exposure. Breast cancer is food. Breast cancer is stress. There are so many elements that all contribute to cancer, any cancer really. And so to try to isolate out one component and say that is the factor that caused breast cancer is nigh unto impossible. What we do know is if you have breast cancer, many breast cancers have estrogen receptors on them. So if you have cells that have mutated and are now dividing quickly, and you introduce estrogen, you're going to cause increased growth potentially. So if you're going to do hormones, it's important to do breast imaging. Breast imaging is its whole controversial topic of its own, so we'll touch on it just briefly. But mammogram is obviously the gold standard. That's what's been studied. But is mammogram really safe? And I don't think they will ever do the study to tell us when we compress that breast tissue, if there's a compromised cell there and we're putting it under that much pressure, are we activating any growth? Sure seems like it could. And you're exposing that tissue to radiation every single year. So are they really safe? Well, that study is never going to be done because that's not beneficial to the system. But I would argue that it's probably not a safe modality. Breast MRI is an option. It's more expensive, but it can be obtained. You're not exposed then to radiation. You're exposed to a magnetic field, which the data does not indicate near the risk with a magnetic field as with a X-ray beam. So that is an option, but more pricey. Comes in at closer to like $500 with Telica, I believe, is the imaging center that will do a breast MRI. Breast ultrasound is actually my preference, but can't obtain it in our city or state. There was a facility that would come in and do breast ultrasound, but they are no longer offering their services. Any of the major imaging, her scan is no longer. That was their last.
The end of March was the last
one. If you,
that was my
they have
plan
been-
every year.
Yeah.
They
Oh,
have
what a
been
bummer.
kicked out of Idaho.
yeah, and we can't figure out.
Nobody will tell me why.
Oh, no.
So you can
I don't know.
And then I
Just they aren't
realized
looking
it's
anymore.
$100.
Yeah.
But you know what's funny is if you have an ultrasound, if you choose ultrasound because you don't wanna go mammogram, and you find something, as was the case for me, that they wanted to further check out, and they recommend a mammogram. But if you're like, well, I don't wanna do a mammogram, then you have no options.
No.
Right.
You have to go pay yourself
Yep.
for an MRI or.
Yeah.
And if you have a
Ultrasound.
mammogram and it's abnormal,
Then they will.
you have to have an ultrasound.
Then you have to have an ultrasound, and I was literally going back and forth to St. Luke's, like, you're making no sense.
No sense.
This
Yeah.
makes zero sense.
Right.
Oh, and by the way, if you have extremely dense breast tissue, a mammogram doesn't even work for you, we still have to have one. What?
Yeah.
Or
Like,
yeah.
I know, I really went toe to toe with both Telica and IMI.
Yeah.
So
Very quick caveat to breast density. Using a topical magnesium with iodine in it
okay,
is just a topical breast rub, or taking iodine orally
I'm taking iodine for that
does
reason, yes.
Helps density?
yes decrease
Oh.
breast density.
Yeah.
So if you want the recipe for iodine and magnesium breast rub, that is works great, or oral iodine
Yeah.
and some selenium. So little caveat. So ultrasound. You could also do a girlfriend trip and go to Utah for breast ultrasounds.
So mad.
Yeah, because you can get them. They have Murray, I think, is where her scan was going to be,
Yeah.
and then a couple places in Oregon, a couple places in Washington.
Hmm.
But ultrasound would be my preference. You don't have radiation exposure. You have good visualization of changes that could be going on in the breast tissue. Thermography is also an option, which a lot of women choose. My hesitancy with thermography is it does have a 30% false negative rate. That means 30% of the time you could be told there's nothing there when there is something there. So if you're doing thermography, you need to be consistent. Because if you have year-to-year scans, you're most likely going to pick something up. I'm just not totally comfortable fully endorsing a procedure with that high of a false negative. So I'm torn on that one. And I know there are huge proponents, and you know that's an individual decision. I lean more towards ultrasound because that false negative rate is not nearly as high. So if you're doing hormones, breast imaging really is important, or knowing that that is a risk. In women who have a family history of breast cancer, in women who have had any kind of radiation potentially, women who may be at higher risk for breast cancer, then I really think it's important to do breast imaging. There are some women who just choose, there's no family history, I'm comfortable accepting that risk, and so we just have that discussion. But there is that potential. If you've got abnormal cells and you're feeding estrogen, you're potentially going to be feeding that cancer growth. Yes.
What about with testosterone and risk breast cancer? If you have someone who has a strong family history, someone who's at a very high risk of breast cancer and they're on low dose testosterone.
Testosterone is not associated with an increased risk of breast cancer. So, yeah. Backing up 1 minute, as far as choosing what hormones, that's based on lab values, but a woman who has had a hysterectomy does not have to have progesterone. A woman who has not had a hysterectomy, has an intact uterus, must have progesterone if you're treating with estrogen. Estrogen stimulates the uterine lining, and if it is not countered by progesterone, you have unlimited growth, so you're going to stimulate irregular bleeding, and that what we call hyperplasia, that thickened lining, can become endometrial cancer. So if you have an intact uterus, you must balance that estrogen with progesterone. The only time it's not as mandatory is if you're only using vaginal estrogen, just to help with vaginal dryness and discomfort. The absorption is not high enough to stimulate that uterine lining, so then you could potentially go without progesterone. but progesterone is happy, man. Progesterone makes you sleep. Progesterone calms you down. So just take progesterone.
We all get to walk away with a free sample.
Right, exactly. Yeah, progesterone is just like the best. So estrogen's the one that has potential for risk. And so that's the one that we usually talk
So
about.
how do you check the levels, like, of those 3 hormones?
Yep.
Is it a blood test that you do, or?
So initial, and I'll go ahead and just segue into that right now because, so the initial evaluation, I'm gonna kind of talk about what would that look like. Initially, we would get labs. I wanna know what your cholesterol looks like because if you are deficient in estrogen, your cholesterol may very well be rising. Estrogen can help mitigate high cholesterol. So I want to know what your lipids are. I want to know what your chemistry panel looks like. Are you having too much sodium, too much potassium? Is your kidney function off? Is your liver function off? So I'm going to get a chemistry panel. I'm going to look at your thyroid because our thyroid is another endocrine organ. And so I want to know, is that thyroid functioning? Is your fatigue and your dry skin and your hair loss, is that estrogen and progesterone related or is that thyroid related? So we're gonna look at that. I'm gonna look at your blood sugars because we know that testosterone and progesterone help with insulin sensitivity. And our culture, because of our diet and everything we're exposed to, we're seeing more and more insulin resistance. So I wanna know what your insulin resistance looks like. So I'm gonna check that. I'm going to do a full hormone panel that includes FSH and LH. Those are the stimulating hormones produced by the pituitary gland that tell the ovaries to, yep, we need to ovulate and now we need to create that uterine lining. And so I'm going to check FSH and LH. I'm going to check estradiol, which is your primary estrogen. I'm going to check your progesterone level. I'm going to check your testosterone. I'm going to check your DHEA. DHEA is a precursor hormone produced by the adrenal glands that can turn into either progesterone or estrogen. Excuse me, either testosterone or estrogen. So I'm going to check all 4 of those levels. And then there's also a chemical called sex hormone binding globulin. That's a protein that circulates in the system that will bind excess hormone. So if I'm treating you with hormone, but I'm not monitoring it, then your SHBG, sex hormone binding globulin, can rise to bind that so there's not as much in the system and effectively decrease what's there for your body to use. SHBG is elevated in women who use oral contraceptives. So we wonder why some women on birth control pills have no libido. Their SHBG is probably through the roof and it's binding that testosterone in their system. So there's a lot of reasons to potentially not use oral contraceptives, and that's just one. But sex hormone binding globulin would also be checked. That's your initial. Then we would start hormones and titrate them. We're gonna look at your labs, what's low, what are your symptoms? Okay, that suggests that you're estrogen deficient, you're testosterone deficient, so we're gonna start treating. And we're gonna give you a small dose, and we're gonna ask again, how are you feeling 4 weeks later? Oh, I'm actually doing great. Or, better, but I'm not quite there. We're gonna titrate again. That takes about 3 months' time. At 3 months, I actually like to obtain a urine hormone screen. So that urine hormone screen is 24 hours of collected urine to assess all of those metabolites. That estrogen that breaks down into those metabolites that can stimulate different breast receptors. I want to see what are those levels, because I can adjust that hormone to raise or lower those metabolites. I want to make sure those metabolites are in a healthy level so that I'm not causing risk with the hormones I'm using. we can, we use what's called Biest, which is a combination of two forms of estrogen. One is estradiol, one is estriol. So I can tweak that pretty closely to change what those metabolites look like. So we check that urine hormone. If we need to tweak anything, we will. Then, if it's going well, I give you a prescription for the next 9 months until you come up to that 1 year mark. And then we would do another urine hormone screen, make sure everything looks great, and then annually thereafter. If during that time you're like, oh, actually I'm getting some breast tenderness. Okay, well, we're gonna tweak that down a little. That's one benefit of using topical estrogens, is you can tweak that on the fly. Like, oh, I'm a little more anxious, maybe I need a little more hormone. Oh, I'm not sleeping real well, maybe I need a little more. Oh, I'm really having some hair growth, maybe I need to back down that testosterone a little. So using topicals are nice because you can adjust them. If you get to the point where you're just stable, you feel good, you're stable, then the pellets can be really nice. Come in every 3 to 4 months, have a pellet inserted, it slowly diffuses over those next 12 to 16 weeks, and it's nice and easy, you don't have to remember anything day to day. So, but I don't jump immediately to pellets. I want to fine tune that dosing and make sure that your symptoms are alleviated and you're not having any breakdown products that could compromise your health. So that's kind of what that program looks like year to year. Having the breast imaging, or at least that discussion, is part of that initial consultation, and then annually we would talk about that, and then whether or not to do a pelvic and pap smear. Estrogen can stimulate that uterine lining, and so being very aware if you have any spotting, that has to be evaluated, because we've got to make sure, get an ultrasound, make sure that uterine lining is not overly thickened or beginning to show any signs of cancer there. I do prefer to have a pap smear going into any hormone treatment. Again, that's a discussion. Not every woman wants to have that pap smear, but from a safety standpoint, if you have any cervical cancer and you start treating with hormones, can you contribute to growth? So a baseline negative is of value, but I don't twist someone's arm. I just provide that recommendation. So with all of that, let me make sure I didn't have another topic to go over. So we talked about the safest method, and then just kind of wrapping this up. Hormones are not the end all be all. I think they're super important for us as women, but the picture is so huge, and it can be really overwhelming because what is your stress level? What food are you eating? What water are you drinking? What's your toxin exposure? What is your exposure to the magnetic field with Wi-Fi and all of our devices and everything? What's your exposure to the microplastics? What's your exposure to glyphosate and some of the other pesticides out there? What's your what are your relationships like? There was a study that was just released about 6 months ago that just looked at individuals and asked them, do you feel lonely? Not if they were truly lonely, but if they had the perception of loneliness. And just simply feeling lonely and disconnected raised their inflammatory markers as compared to their counterparts. So what are your relationships? Where are you engaging with other people? We're meant to be social individuals, and being isolated has negative consequences on our health. Serving. Are you giving to others? We know that serving reduces risk of high blood pressure by 40% if you serve over 200 hours a year. Like, who knew? That is crazy. But there are very measurable health benefits of giving of yourself to others.
There's also measurable, and I don't know what the measure is, but forgiving,
Absolutely.
forgiveness is
Yes.
huge.
Which ties back
For
into
mental
that
health.
stress, but yes, harboring unforgiveness, harboring any anger has measurable deleterious effects on our health. And I don't have those statistics
I
off
don't
the top of
either.
my
I don't
head,
know
but
that
yes. And you know, just our mindset, hopefulness also has measurable effects. But what's your sunlight exposure? Are you getting out and getting that vitamin D? What about drainage? And with drainage, I'm specifically talking about, are you having a bowel movement every single day? If you're not, your system is not balanced. You've got to be eliminating. What's your gut health? We are exposed to so much and it breaks down our gut. And you know, so that actually directly impacts hormones, because when that liver breaks down the estrogens into all those metabolites, it packages those and sends them into the gut to be eliminated. If we're not having a bowel movement daily, if that gut is sluggish, if our microbiome is off, we actually reabsorb those metabolites, send them back into circulation where they can then go and impact all those receptors, and can change our hormone levels. So there's so many factors. You know, are we supporting our energy? Our mitochondria are in every cell. It's what produces our energy for every cellular function. But are we supporting that? We need magnesium for that. We need vitamin D for that. We need oxygen for that. Are we supporting the mitochondria? Are we exercising? We so need a regular exercise regimen. And the data now is very clear that after age 40, as women, we need resistance training. It's not just the walking, it's not just the aerobics that our moms did. We need resistance, we need weight to maintain our muscle mass, maintain our hormone levels, and yeah, it's so important. You know, so what's your exercise program? What is your sleep pattern? You know, do you have a bunch of EMF in your bedroom? Is your cell phone in there? Is your Wi-Fi connected to the TV in there? All of that has a negative effect on our sleep. And also, you know, being aware of our circadian rhythm. We were meant to wake up with the light, and if we have our blackout curtains, it might seem to be a sleep aid, but it really can be a negative. You know, our bodies were meant to work with the circadian rhythm and that sunshine. So just all of those other factors. It isn't just one thing that's going to be the fix-all. We have so many factors, but that in and of itself can be overwhelming. Like, where do I even start with that? Like, I'm broken in every area. Every one of those is bad. But it's the little girl that saw the elephant. How do you eat an elephant? One bite at a time. So it's just one measurable thing. Pick one item that you can effectively begin to adjust. Water, I think, is an area that I would encourage everyone to start with. Get a water distiller. You know, if you look at the toxins in our water, it's horrendous. About 71 million people in the US are exposed to levels of radon that are too high in their water. And radon goes into the bones and begins the destruction of our bones. That's where we absorb the radon if we're drinking it. So a water distiller removes viruses, it removes bacteria, it removes the heavy metals, it removes the microplastics, you know, and it heats it because all of those things have a higher boiling point than water. So you heat that water up, the water evaporates, and then you recondense it into a glass jar and can drink it from the glass jar. But if that's an area that you can access, that, you know, water is probably the most foundational thing in our life.
Yep.
Start with water, start with your air, start with your food, whatever it can be that you can start with. Don't feel like you have to change your whole world in one setting, but what are we putting on our skin? What are we cleaning with? What are we inhaling? You know, all of that dust. If we live near a farm and they're spraying glyphosate, that travels in the air and that settles in our dust particles, and depending on how you're dusting your house, you're just inhaling all of it. So, you know, it can be overwhelming because you can feel like, how do I even protect myself? The whole world is toxic. But I go back to Esther, and this is not a direct quote, but who knows but that we were born for such a time as this. God knew he was putting us in this era, and you know, so we take the knowledge and wisdom that's available, we utilize it to the best that we can to be stewards of the bodies we were given. So, any questions?
So much good information. Thank you. This is great.
Absolutely.
Is
Yes.
there a water system or like brand that you?
It's price. Everything's pricey.
Yes.
If it's good,
Yes,
it's pricey.
It always is. Yeah.
I love my pure water.
Okay.
There's a large one that you actually can like hook into your system,
Mhm.
but unless you do special wiring, you're distilling your water and then sending it through plastic pipes to your
Oh.
refrigerator, so that's pretty counterproductive. So I actually like the countertop one with my pure water. And
Okay.
yeah,
And we bought a Kangen
Mhm.
water
Yeah.
that is more, I think it goes over some, I don't know exactly, but it takes out the chemicals and all the
Yep.
stuff that's
Is that like the
Eagle
freestanding
water.
one? That,
Mhm.
okay. That you
And I
pour-
have it down under the sink,
Okay.
yeah,
Yeah.
that you
So-
have to have a filter for,
But
yeah.
nice. Okay.
So
pricey as
But
well.
yeah, they're all
All is-
expensive. It's all
But distilling would
But
be
I
better
think
than
the
like a
more-
Berkey.
A bird.
So if you compare the toxin report with the Berkey versus the toxin report with my pure water did remove more.
Mhm.
So that's why I went with that one. But a Berkey is certainly better than drinking out of your refrigerator or your Brita.
Right. Yeah.
So
Yeah.
yeah,
So is pure water a distiller?
it is.
This
Yep.
says distiller.
Yeah, yep. My pure water, it's about. Just, sorry, I'm gonna not invite him to our party. If he were outside, I'd let him stay, but it's about that wide, and then so kind of the size of like an espresso machine, and then it has a 3-liter glass jar that it distills into. It takes about 3 hours to fill the 3-liter. So I kind of keep mine running because there's 3 of us in the house, and so that's enough to cook with and
You just put your
drink.
tap water in there.
Correct. Yep. You fill it and then it distills over time, and then you can either put it in the fridge or we almost drink it right then immediately. It doesn't stay in the jar very long.
Yeah.
So, yep.
So you're, just for conversation, I've been on the BioWest
Mhm.
hormone system now for probably going on a year,
Okay.
and I love it.
Yeah.
I was on estradiol
Yes.
for years,
Patch or oral?
oral,
Okay.
oral,
Mm-hmm.
0.5 milligrams.
Okay.
I know, not much.
Yeah, yeah.
I'm
So you were
thinking,
getting
wow, how much
point-
was?
But you were getting 0.05 of that.
Yeah,
In
and
an
it
oral
worked
dose.
for me.
Mhm.
For what I know.
Yeah.
And then when we started here
Mhm.
and John wanted to go off the oral and let's do something.
Yeah.
And that little interim of the vaginal dryness, the painful sexual intercourse,
Yes.
lots of other things. So going on this, it's like it's given me back to me. cognitive
Yes.
thinking, even the brain fog is gone. I just wonder now, I've had I've done the 24-hour yarn.
Yep.
And of course, he's watching it, you
Mhm.
could watch it too,
Mhm.
but that,
Yes,
Um,
absolutely. Have a great day.
yeah, just on my doses, I seem to be in the range of normal.
Yep.
But when you have to do that questionnaire every
Mhm.
week, I
Mhm.
try not to answer, cause we go too much.
Right. Right?
Yes, we go, and so the tiredness and stuff is just, I need to slow down and take some sleep.
Right.
I don't like to sleep in Idaho in the summertime.
Exactly.
It's light. I should
Man,
be
it
out
gets
playing.
it gets warm and I want to be outside doing everything. Yes.
Everything.
Yes. So
So you get in inside by 11 and.
right.
you go.
So some of those symptoms have overlap with other things.
Oh, yeah.
The symptom questionnaire, we have a
Is that with the
Cause I don't know if
program?
anybody's on
That's
that BioS.
right.
Is that with Bright? Okay.
it is with Bright, but it's with any of them. Sarah, do you have the symptom cards right there?
I think so, hold on.
I know I have one at my desk.
Yeah, I used to.
I'll just grab the one off my desk really quick.
That's called BioTune? Is that what you
It's
said?
that, it's their Bright, BRITE system that she's talking about.
Yeah,
It's the
yeah.
BioS and the testosterone
All
and
three of
the
those.
progesterone. And I've opted to do the topical,
Okay.
so
And you've noticed a
it
real
gets to,
difference.
huge,
So this is just
immediately.
really, that's not a
Like
great
within the week.
Oh, wow.
Yeah, I'm just like, wow.
Yeah,
Yeah.
it makes a huge difference.
Yeah.
Are you on oral progesterone or topical?
Topical.
Yeah.
So the topical's between the legs.
Yep.
So I'm wondering, as you're saying, so is my skin sort of.
But if your hormone levels on testing are adequate, then you're
Yeah.
absorbing.
Yeah.
So, and if you're not symptomatic, then you're absorbing. So,
And he said, John said I could increase them, but I thought, I increased the testosterone a little bit, and
Mhm.
I don't know if it was just I was doing too much in life and I was getting over testy.
Yep.
Then it's like, no, I don't want to.
yeah,
So I left it where it was supposed to be
right.
instead of increasing.
Very
Which that's
helpful.
yeah, totally reasonable.
Yeah.
So.
Do you use Irwin Pharmacy?
We do.
Okay.
So you can do the Bright program,
Mm-hmm.
or we can prescribe it through Irwin in Grangeville.
Okay.
Yep.
Yeah, that's what I've done. I didn't do
The
the
bright.
Bright,
And
but I haven't had any questionnaires or anything.
right, so I can actually
Since.
make you a copy of this. It's helpful to just keep on hand, just to remind yourself every few weeks, like, oh yeah, I'm doing well, or oh, I am having those. Because from day to day, we just accept how we're feeling, and it sometimes takes being able to actually visualize it to realize, oh yeah.
I had invited a couple of gals who were asking questions and they weren't able to be here today. And one of the gals
That's why they
says, does it make your body feel alive again? And I said, yes, actually it does.
It does. Yes, exactly. It can have a dramatic effect.
Right.
Yeah. And like I said,
Yeah, a lot in
every
lots of
organ
areas,
system,
yeah.
yep, every organ system can benefit. So, yeah.
So I have a question regarding menopause.
Yep.
So if you're in menopause and you're treating someone for hormones, are you trying to get them back to where they were before they went into menopause? Or, so the levels are gonna be different?
Correct, yes.
Okay.
So, levels to protect the brain, protect the heart, protect the bones, those levels are not levels to menstruate. And it sounds kind of silly, but if the vaginal health is good, the levels are good. That's really rule of thumb. If you're not having vaginal dryness, discomfort, frequent UTIs, then your estrogen is probably at an appropriate level. That's not technical. We are still gonna do testing, but that's a good rule of thumb. But no, we are not gonna take you back to your premenopausal hormone levels, which are much higher than menopausal levels.
I have
Thank you, ma'am.
copies.
Oh,
I have copies
Excellent.
these, for
Yes.
anyone who wants them. They're not the clearest, but they work.
But they're better than mine, at least yours is color.
Yeah.
Mine's not even color.
Color now.
Yes, and that should be the one you have.